How many of you in your class?
I think around 16 students taking
Oh,
women's health,
okay. 16
around that.
plus 16 plus 1, right? No, it won't be 16, only AIM student.
Miss Nelman, I will remind them now.
Yes,
Okay.
because it is 1 hour class, time just goes by.
Yes, understood. Okay.
Okay, I think we can start the class. Almost more than 50% has come. Okay. So today we are going to see about practical aspect of antenatal period. So I hope you already had your theory antenatal. So today we are going to have your practical antenatal. So antenatal period means the period during your delivery. The period during your pregnancy. That is before your delivery. Okay. So the whole duration of pregnancy is divided into 3 trimester. So it is 3 months, 1 to 3 months, then 4 to 6 months, then 7 to 10 months. Or like if you want to calculate in weeks also, you will be able to calculate according to this. Is that clear? So, just to brush up, this is your guidelines for giving exercise for a woman during pregnancy. So, you need to follow these guidelines throughout the pregnancy so that you will be able to avoid any miscarriage or you will be able to avoid any induced abortion or anything. So especially you need to be very careful in the first trimester because there is a lot of chances for abortion in the first trimester. So normally the placenta will take at least 12 to nearly 12 to 20 weeks for it to 1 minute. 1 minute. I think my kitchen sound is disturbing a lot. Okay. So, first 3 months, nearly 20 weeks, it's very crucial period for a mother because during this time, the placenta will be getting embedded. So, it will take from 12, in between from 12 to 20, anytime the placenta will get embedded in the uterus. So till it is getting embedded, there is very high chance of getting miscarriage. So you need to be very careful during the first 3 months. So that's why usually the doctors will say to be very careful. Don't bend, don't lift heavy weights, or don't travel much, or don't exercise too much during the first trimester so that you have any of the problem. Is that clear? So throughout our exercising duration, normally women will start doing exercises at the second trimester. Why? Because almost it will take 2 months for them to confirm the pregnancy properly. So with the ultrasound and other things, they will confirm it very properly. So it will take at least 1.5 to 2 months for them to confirm correctly. So after that, another 1 month they will be little slow. Then they can start exercising from the second trimester onwards. So during that time, you need to avoid this jerky, bouncy, or ballistic movements. You need to do only mild to moderate exercise. You should not go beyond that, and you can do at least 3 times a week, not daily. So it is like doing exercise on alternative days, and the exercise session can be nearly 40 to 45 minutes and not more than that. You should have a proper cool down and warm up session. Then you can include the flexibility and mobility exercise during the warm up and cool down session, but anytime you have to avoid any ballistic stretching or ballistic movement. Then don't exercise in a very hot climate, because temperature is very important. During pregnancy, the core temperature of the body will be a little bit higher. So when you are doing exercise in a hot climate, if the core temperature rises beyond, then it may induce miscarriage. So you need to avoid exercising in hot climate. The body temperature should not go more than 38 degrees Celsius. Need to keep that in mind. Then the maternal heart rate should not exceed more than 140 beats per minute. So don't exercise vigorously and don't exercise continuously for 45 minutes. You can do maximum of 15 minutes, then take some minutes of rest, then again you can continue your exercise. Then avoid dehydration, have ample of fluid. Then if the person is a very sedentary lifestyle person, then you better give them a low intensity exercise. Don't give them moderate intensity also. So slowly you can pick up the exercise. You can give any kind of aerobics like walking, cycling, aerobic dancing, but not like the whole Zumba, or don't go for the fast step. You can give a mild aerobic dancing. Then you can also give swimming, because swimming is the best exercise throughout the pregnancy. Then during the after the first trimester, you have to avoid supine lying. They should not lie down in supine for more than 15 minutes continuously. So sorry, more than 5 minutes continuously. Why? Because the weight of the abdomen, the weight of the uterus will be compressing the inferior vena cava in the supine lying position. So this will reduce the venous return, and this may cause some issue in blood circulation. That's why you need to avoid this supine lying. Then avoid standing motionless for a very long time. Avoid competitive exercises. Don't give any stressful exercises in first trimester, if at all, if they come to you. Normally they don't come to you in the first trimester, but if they come to you, you can give them, advise them very mild exercises. Then maximum you can induce the Swiss ball, because sitting on the Swiss ball will be stimulating your core muscles, or it is automatically will be giving an exercise to your core muscles, that is your flexors and the abdominal muscle. So during pregnancy, this both muscles will become weaker. So when you make them to do exercise in Swiss ball, it will be it will give them a good strengthening for the core muscles. So you can introduce this Swiss ball. Then this Swiss ball will give them a good proprioception training, which is very important during pregnancy. So that's why you need to introduce the Swiss ball. So you avoid overstretching. Mainly do a very mild active stretching. Passive stretching also you can avoid. You can teach them self stretching, so that they will be able to decide their stretching duration and stretching amount. Avoid single leg weight bearing because already during pregnancy they will have all the pelvic joints will be little lax. When they stand in a single leg for a long time, it will cause SI joint problem. So they have to avoid this single leg weight bearing. Then when getting up from lying to sitting, you need to be very slow. Anyways, I'm going to teach you how to make them uh, stand up from lying. Then avoid Valsova maneuver. Valsova maneuver is nothing but breath holding technique. You have to avoid that. Why? Because when you do Valsova maneuver, this will again increase the intra-abdominal pressure, which will compress your inferior vena cava. And when you compress inferior vena cava, the venous return will be reduced. So you need to avoid that. Then don't do any developmental stretching. There is continuous stretching. You can always go for cross training. Cross training means little bit of aerobics, little bit of stretching, little bit of strengthening like that. So that is the best one. Then always encourage them to do exercise after emptying the bladder, because already the uterus will be heavy compressing the bladder. If they do exercise in full bladder, they may lead to it may lead to incontinence, because the pelvic floor muscles will be weak, so it will lead to incontinence. Then whenever you are doing stretching, you need to be very very careful, especially for hamstring and adductor stretching. You need to be very careful because the joints will be loose, and the joint capsules, everything will be very relaxed. So if you do overstretching, it may lead to subluxation or sometimes dislocation also. So you need to be very careful. Then the women should always do exercise according to Bogue scale, that is in between 12 to 14. So in 12 to 14, reading will be something like hard to somewhat hard. So when doing exercise, they may not be able to aware of this. So you can just introduce them about the talk test. So talk test is when they are doing exercise, they should be able to talk to somebody, or they should be able to answer your questions and the thing without any breathlessness. So when they are doing exercise and talking, they should not have any breathlessness. So the exercise should be in that particular level. If they have any breathlessness, they have to reduce their exercise level. Okay, so that is called talk test. Then regarding the contraindications, we have absolute contraindication, where we should never ask these kind of women to do exercise. So if they have blood pressure more than 140 by 90, so normally during pregnancy, the blood pressure will come down, especially in the initial trimester, the blood pressure will come down. Then slowly it will increase, but not to this level. Okay, so if they have a diagnosed heart disease, then you have to avoid. Then if they have any premature rupture of membrane in sense the cervical membrane, which will be covering the uterus. So if there is any rupture, then don't do exercise. Placenta abruption, history of preterm delivery, that is previously if they have delivered the baby before the term, before 36 weeks, then you have to avoid exercises. Then if they have history of recurrent miscarriage, then you have to avoid. Persistent vaginal bleeding, you have to avoid. Then if they have intrauterine growth retardation, that means the baby inside the uterus, if it is not growing according to the weeks, then you have to avoid excising. Then incompetent cervix. So the cervix have to be closed completely. It will be for there will be something like car kind of thing which will be closing the cervix. So till delivery, the cervix has to be closed. If it is having any gap, then don't do exercise, because all these movements may induce pregnancy pain, and it may induce delivery. Then if they have any thrombophlebitis, pulmonary embolism, you have to avoid exercise, because this may lead to the emboli may just move up, and it may go and block any of the veins and arteries in the heart and in the brain. So this may lead to stroke or this may lead to heart attack. So you have to avoid preeclampsia. Preeclampsia is a symptom of showing eclampsia during delivery. So if they have any symptom of preeclampsia, then don't do exercise. Then polyhydramnios means increased fluids. Oligohydramnios means reduced fluids. In both the cases, you should not do exercise. Then if they have any acute distress, fetal distress, acute infection, don't do exercise. See, I'm not going in detail of this because you would have already read this in your theory. Is that clear? So that's why I'm not going in detail. I'm just going like a brush up. So each one of the contraindication has its own uh, explanation. I think she would have done already. Okay. So benefits of exercise, again, these are the benefits. We don't need to go much in detail because we know what are the benefits of exercise already. So we will go into our actual today's class. So first, before giving exercise, you need to give antenatal. You need to go assess the patient antenatally. So normally, a person may come to you for uh, antenatal class, that is a 6 weeks class, or they may come to you for any problem like they have low back pain, they have like a thoracic pain like that. Or generally for their fitness, they may come to physiotherapy. So during pregnancy, they will be coming for antenatal classes, or they will be coming with any of the problems or pregnancy, any kind of pregnancy discomfort, or they may be coming to you with any of you see they may be coming to you with just out of their curiosity, they may be coming to you for their fitness level. Is that clear? So any kind of patient you need to take up only if they have medical reference, that means doctor's reference, because the doctors will be checking all the contraindication, and if they have any, they will ask them to avoid the exercise. So you need to be very careful whenever you're taking the patient. You have to go through their case sheet completely, know their complete details, then only you have to start exercise, because pregnancy is something precious. So you cannot just by our mistake, we cannot lose the pregnancy. Okay, so you need to be very careful regarding this. So these are some of the common things you will be getting from the medical records, like age of the person. Age is very important because if they are very old, and if it is their first pregnancy, you have to better avoid certain movements and avoid certain exercise. You need to be very very careful. Then height and weight, and BMI, maybe to know whether the person is obese or under uh, normal weight. Then marital status, occupation. See, main marital status. This is for Western country people, where they go for pregnancy even before marriage. Then occupation, you need to know to avoid certain exercises, or to make them aware of certain, to teach them ergonomics, to make them aware of certain problems in their occupation. So you need to know their occupation, you need to know their hobbies. So this too will help you to give them a good ergonomic advice. Then their address, their consultant name, then if they have any chief complaint. So mainly chief complaint will be like low back pain, or they have any swelling, they have any tightness, they have any pain in the thorax, they have any pain in the knee, so anything, something like that. So some women may not have this chief complaint. Okay, so pregnancy is not a disease; it is a normal physiological changes that is happening in a woman's life. So some women may be very much normal; they will be able to compete with the physiological changes, and they may not have any other issue. Okay, so it is not mandatory that every woman should have this chief complaint. Then next is history taking. So this history taking is very, very important. Mainly you will be getting almost all the details from the history taking only. We may not be going in depth of the objective assessment. So first is like history, taking present history in case if they have any problem. According to that, you can go with the history. So present history, onset of the problem, how it had, whether it was gradual. So especially low back pain and all, it will not be sudden, it will be gradual pain. So almost all the pain will be gradual pain. So you have to get to know about the onset of problem. If they don't have chief complaint, then you will not have this present history. Is that clear? Then personal history, whether the woman is smoker or alcoholic. So why smoker and alcoholic? Both the things you need to advise them to quit. So that's why you need to know about this. Then hobbies you have to know, so that when you're teaching relaxation and technique, you will be going along with their hobbies. So you need to teach relaxation according to their hobbies. So that's why you need to know about their hobbies. Then regarding their diet, because here diet is very, very important. The women may end up during pregnancy, they may have this constipation problem. So if they are straining more for defecation, it may further lead to reduction in pelvic floor muscle power. So that's why you need to know about their diet. And as a physiotherapist, you can also give advices regarding their diet. So they have to take proper fiber intake, and they have to take proper fluids so that they can avoid this constipation. And you have to also teach them proper defecating position whenever you are going with the management. Okay. Then medical history, just to know whether they have any medical problem. So if they have any medical problem, what type of medications they are taking, how long they are taking, how long they are affected with this medical problem. So all these things you have to ask in medical history. Then obstructive history, you have to know GPAL. G is gravida, P is parity, A is abortion, and L is live birth. So gravida, how many times they have been pregnant. Parity, how many times they had been delivered, because some of the pregnancy may end in miscarriage, some of the pregnancy may end in like termination, all those things. So gravida is number of times they are pregnant, parity is number of times they have delivered. So both may not be same. Then A is abortion and L is live birth. Is that clear? So normally obstructive history is given by this GPAL. G is, I repeat, G is gravida, number of times they are pregnant. P is parity, number of times they have delivered. A is abortion, number of times they had abortion or miscarriage or medical termination. L is how many live children they have. Is that clear? So this is obstructive history. Then along with that, you have, if the mother is second time pregnant or third time pregnant, you need to ask them what type of delivery they had, whether they had normal delivery or they had cesarean delivery, like that. So what type of delivery they had. Then next is gynecological history. Gynecological history is related to their menstrual cycle, whether they have normal menstrual cycle or irregular menstrual cycle, whether they have any hormonal abnormalities. So if they have hormonal abnormalities, definitely they would not have a regular cycle, they will have an irregular cycle. That clear? So that one you have to get from gynecological history. Then surgical history, any surgery they have undergone previously. Then previous management, this is related to pregnancy. So if they had already, they are pregnant, and if they had undergone any treatment, then that treatment you have to get in this previous management. Okay, it is not general previous management, it is related to pregnancy previous management. So if they have undergone any medication, what type of medications they have used during previous delivery, any surgeries undergone, any physiotherapy treatment undergone, any diet, acupuncture and herbal remedies they have taken during previous pregnancy. So this one from related to previous pregnancy alone. So that's all about the history. Almost everything you have to get from history only. Then from the case sheet, you have to check their BMI, blood pressure, what is urinary analysis, if they have any urinary infection or anything. If they have urinary infection, they will have frequency of urination, which will lead to reduce pelvic floor muscle power. So that's why you need to check the urinary analysis. Then any blood test results will be there in the case sheet. Check for any edema. Maybe when they are coming to the department, they may not have this edema, but during pregnancy, whether they had edema. So this one you have to check. Okay, so edema in the feet or edema in the hands. Then what is a fetal movement? So normally after 8 weeks, there will be fetal movement, but the mother may not be aware of the fetal movement. Maximum after 15 weeks or 20 weeks only the mother will be able to feel the fetal movement. So till that, doctors will be able to check the fetal movement. So, and they would have written about the fetal movement in the case sheet. So you can check that. So why we want to know the fetal growth should be normal if you are doing exercise, and the fetal movement also should be normal. If it is reduced, then don't give exercise. So for that, you have to check this. Then fetal heart rate. So this also you can know if the heart rate is higher than 150 beats per minute, then means the baby is in distress. So don't give exercise. So you have to know about this too to either to um, rule out the contraindication. Then fundus height. I think you know what is fundus height. Fundus height is like fundus is the upper part of the uterus. So as the abdomen is increasing in its size, slowly the fundus also will be, you will be able to watch the fundus. Okay, so you according to the weeks, you have to cross check whether the fundal height is normal or reduced. If the fundal height is reduced, then that means there is intrauterine growth retardation. So you have to avoid exercise. So that's why you need to check the fundus height. So normally after 2 months only, the uterus will be coming up into the abdomen cavity. So slowly after 2 months, the abdomen will be increasing gradually. So you have to check for the fundus height. Then they might also have taken any other antenatal screening. So this antenatal screening is done to check whether they had any genetical problem or fetal abnormalities. Okay, so to rule out the genetical problem on fetal abnormalities, the mother would have undergone this antenatal screening. So you can check their results. So if they have any abnormality, then accordingly you can reduce the exercise, or you have to see whether you can totally um, don't give exercise at all. So according to the results, you have to decide. And maximum, the fetal abnormality, you can go with the exercise. You can go with a mild exercise until and unless they have growth retardation. Okay. So why for growth retardation we should not give exercise means, um, if they have growth retardation, it means they have reduced oxygen level. So already if the fetus is getting reduced oxygen, and if you do exercise, the oxygen will be deviated to your other parts. So the fetus will get still more reduced oxygen, which may lead to totally underdevelopment of the baby or totally death of the baby. So that's why you need to avoid exercise whenever they have intrauterine growth retardation. Is that clear? So that one you can check with the fundus height. So if you want, I can show you the picture. See, I'm just taking the class in keeping in mind that already you had the antenatal theory class. If you have any other doubt regarding the theory, then you can WhatsApp me or you can ask me in the class. Okay, so next is your objective assessment. So you need to check for the posture, you need to check for the muscle power, you need to check for the range of motion and sensation. But here posture, you will be able to assess all three postures, that is sitting, standing and lying. Muscle power, generally you can just check for the muscle power, but don't go very in depth and don't give dumbbells or don't give any other weights and check for muscle power. Okay, just go with the manual muscle power if at all you need. So mainly you have to check the abdominal muscle power and you have to check your pelvic floor muscle power, which will, these two muscles will be definitely affected. So you have to check for this two. Then you can go for active ROM testing. So visual active ROM testing you can do. You can just ask them to do active exercise and check whether they are able to do full range. So if they are not able to do full range, then you ask them uh, whether they have like whether they had full range before pregnancy. Some patient, but some person may have reduced range of motion before pregnancy also. So in that case, like pregnancy is nothing to do with that. So you have to check that. Then sensation. So sometimes the sensation may be affected because of their posture. So because of the rounded posture, the sensation may be affected. So you have to keep that in mind. So the common problems they encounter is pain, swelling, stiffness, and reduced muscle power, especially in abdomen and pelvic floor. So we will go in detail little bit. So this is first thing we will see about the posture. So this is about the posture. So you can just see the mother, because of the increased abdomen, the center of gravity, center of line of gravity will not be like normal. Okay, so it will be deviated. It will be pulled towards anteriorly so that they are able to accommodate the increased abdomen. Okay. So this is about the posture. You can see this is the normal posture where you will have a normal curvature, but because of the increased abdomen, they will be having increased lordosis and increased kyphosis. If they have increased lordosis, the abdomen is pulling forward, so they will be having increased lordosis. This increased lordosis will lead to increased kyphosis. Okay, so this is in the spine. So because of increased lordosis, the chin will be anteriorly protruded. Okay, and because of this increased lordosis, the pelvis will be tilted. So this is the main reason for change in your line of gravity. Is that clear? So normally the gravity, the line of gravity has to pass through S2 and it will be passing through your knee, posteriorly to the knee and at the center of ankle. But during pregnancy, it will not be passing through that. It will be passing little anteriorly. So let me show you one video for you to. So this is the deviation you will get in the line of gravity. So the chin will be protrude forward. The scapula will be protracted because of kyphosis. The scapula will be protracted. The shoulder girdle will become little rounded. So since the shoulder girdle is becoming rounded, the hand will be falling forward. Is that clear? So the hand upper limb will be falling forward, so that will lead to internal rotation of the upper limb. Then the cervix will be increased in lordosis, thoracic will be increased in kyphosis, then lumbar will be increased in lordosis, then the angle will be increased, the sacrococcygeal angle will be increased, leading to pelvic tilt, anterior pelvic tilt, then knee will be hyperextended to balance the increased abdomen and balance the line of gravity, the foot will be pronated. Is that clear? So these are the changes. So why these changes occurs, we'll just see a video and we will understand that. Okay, so 1 minute. So since it is online class, like we are going with videos, otherwise we would have able to demonstrate you in person. Okay, so watch this. Okay, so I repeat this video again. So hope you understood this. So because of the increase in the abdomen, the pelvic will be tilting, the abdomen will be pulling the pelvis forward, and the pelvic will be tilting, and this pelvic tilt will lead to increased lordosis. And as the lordosis increase, to compensate this lumbar lordosis, the thoracic will go for kyphosis and the cervical will go for lordosis again. So this spinal changes will lead to lot of other changes, like from head to toe the muscles will undergo changes because of this spinal curvature changes. Okay, so the muscles in the anterior side. So here if you see, the neck flexors will undergo weakness, the neck extensors will undergo tightness. Is that clear? So neck extensors will undergo tightness, neck flexors will undergo weakness. Same here in the thoracic, if you see, the scapular muscles will undergo weakness and the chest muscles will undergo tightness. So anterior muscles will undergo tightness, posterior muscles will undergo weakness. So when you come to lumbar, the abdomen muscle will undergo weakness and the lumbar extensors will undergo tightness. So here when you see the hip flexors will undergo weakness and hip extensors will undergo tightness. So same in the knee. So extensors will undergo weakness and flexors will undergo tightness. So like this, because of the spine, all the whole body from the head to toe will undergo these changes as the line of gravity changes. So as a physio, if you want to correct the posture, definitely you need to strengthen the weakened muscles and stretch the tightened muscles. Once you do that, then only you will be able to maintain a normal posture. Okay, but we cannot do this posture correction like normal person in a pregnant woman, because during this pregnancy there will be ongoing changes. So it is very difficult for us to continuously strengthen the muscle and loosen the tightened muscle. So we need to see how we are going to teach posture correction in a pregnant woman. Okay, so we will see that. Okay. So next is, so this is in the posture. So when you assess posture, you have to look for all these changes. Then next is regarding the gait. When posture changes, automatically the gait also will changes. They will be going for a vandal gait. So maybe many pregnant women or your siblings or your relatives, you might have seen them walking little differently. So they walk in a very broad base support. Why they walk in a broad base support is to balance the changed COG inside the base of support. So just to balance the line of gravity, they go for a broad base support. and the external foot progression angle will be reduced. Then pelvic obliquity will be little bit different, and pelvic rotation also will be different, and definitely they will be having hyperextension of knee. Okay, so they will be walking with this. So first you have to correct your posture, then second you have to correct their gait. Okay, so this is your second assessment. Then, so these are the common weakening muscles. So you can do a MMT to check their muscle weakness, or generally also you can teach strengthening for all these muscles. So as I said, in with the posture, the neck flexors will undergo weakness. The shoulder retractors, that is in the thoracic, the scapular muscles will be undergoing weakness. Then shoulder external rotators will undergo weakness because the upper limb will be always in internal rotation. Then anteriorly in the lumbar, abdomen will undergo weakness. Then hip extensors, abductors will undergo weakness. Ankle plantar flexors will undergo weakness. So all the opposite muscle group will undergo tightness. So when you know the weakened muscles, automatically the opposite muscle group will undergo tightness. So as a PT, we will know these are the problems that will be happening in a women's life in during the pregnancy. So you need to do posture correction. You need to strengthen the weakened muscles. You need to stretch the tightened muscles. You need to give exercises to improve the proprioception. You need to teach them good positioning. You need to teach them ROM exercise. You need to teach them relaxation technique. You need to teach them perineal massage. Okay, so in this, so ROM exercise is nothing but active exercises. So you can teach them normal active movements. So they have to do self ROM active exercises. Okay, so you can teach them that. So this is a general one, because like we cannot just go from whole upper limb, lower limb ROM exercises. I will not be able to teach now. So whichever joint is affected, that for that joint you have to do active ROM exercises. Is that clear? Then relaxation technique during your exercise therapy, when you were learning your exercise therapy, you would have learned about something called visual uh, imaginary relaxation technique. So you have to teach that visual imaginary relaxation technique. So I will teach that again. Positioning, you can teach them how to sit, how to stand, how to bend. Then they have to undergo a side lying position, because they cannot lie down in supine for a very long time. So you have to teach them how to lie down in the side lying position. Okay, so remaining all these things I will teach you now. So first let me teach you about posture. Okay, so watch this video for posture correction, then we will go into the slides. See, the videos are having little lesser volume. So you can watch here. So they have almost corrected all. Okay, so like posture is very important during pregnancy. So not only to maintain not only to maintain the muscle power and avoid tightness, but also it is very good for the baby. So you need to be very careful. You have to make them aware of the posture. So definitely there is going to be little bit change. So teach them, make them to stand in front of a mirror. You can just demonstrate on your body what is correct posture, and you make them to be aware of it. Because simply if you are teaching them and leaving, it may not help them, because they will not be aware of the changes. They will not be aware that their shoulder is rounded. They will not be aware that their chin is protruded forward. So make them to stand in front of a mirror and correct them properly and create the awareness. Okay, so I'll show you another video. Okay, so we will see one more video about sitting. So this is for sitting posture. Previously we saw for standing posture. So in this videos, we have seen how to create awareness for the women to maintain the normal posture. Okay. So tomorrow's class, we will see how to teach them exercise to avoid this kind of abnormal posture. Okay. So if you have any doubt, you WhatsApp me. As now we don't have time, it's already 9 o'clock. The other person might have logged in. Okay, so I'm just closing the class. If you have any doubt, you just WhatsApp me. Okay, most probably we will meet you on, I'll meet you on Friday. Okay, thank you.